Hey y'all. Hey Gargana. Hey David. Hey Explorer. Hey Dick and Shadows. Hey Susan, how are you? Jadisa, how's it going? Come on. Hey NatureNet. Hey Texas. Hey Banker Stephanie. Hey JT. Hey Karen. Hey Kimchi. Hey Lan. Well, alright. Hey Lexi. I'm good. How are you, Line? Hey Amber. Hey Laura. Good evening. Hey y'all, welcome to Tiffocracy. I am your host, Dr. Tiffany Najberg. I am board certified in emergency medicine. I own and operate an urgent care in Shreveport, Louisiana. The address is above my head. And this is on Tiffocracy. We deal with all manner of science topics, although tonight's special guest, that gay doctor, is actually going to be talking about monkeypox, of which he has some firsthand knowledge of. So, and also, I am openly and proudly transgender. This is Transtastic Tuesday, and I wanted to say Happy Pride to everybody. And there he is. Let's bring him on.
Hey.
How are you?
I'm great. How are you?
Oh, pretty good. Pretty good. I hope you're starting to feel better.
Yeah, I honestly feel 100%. I'm just kind of waiting on a few little lesions to completely go away before I release myself into the wild again.
So, by the way, besides saying, hey, that gay doctor, do you have something you'd prefer me to call you? Or
You can call me Dr. John. I don't share my full name, but John is
okay.
Good.
All right. So, yeah, I'm just Tiffany or Tiff when I'm outside of my job. So,
okay, perfect. And you do emergency medicine?
Yeah, except nowadays I own and operate an urgent care because I do also gender affirming care and some primary care.
Amazing. I love that.
I was boarded in emergency medicine. I was at Charity Hospital from 03 to 07 in New Orleans. So
okay,
that's my. How about you?
I do primary care. Yeah, I work at an FQHC on the south side of Chicago. So we do a lot of patients who don't have insurance or undocumented
awesome
stuff like that. Yeah, yeah, it's rewarding. That's challenging, but it's very rewarding.
my our practice, my practice is actually aimed at uninsured and underinsured. It's not like a free clinic, but it's we're kind of bare bounds as far as costs. So
great, I love that.
And I also do I also am the medical director for actually an HIV clinic and stuff like that too. So
wow, you wear a lot of hats. It sounds like.
I spent 18 years doing the by the hour ER thing, and I do love emergency medicine. I love the critical care stuff, but to be honest, I'm about as burnt out as it gets on that stuff. So, and I decided that I actually like continuity of care and stuff like that, and I do want to help community.
Good, I love that. Me too. It's very rewarding to have a lot of continuity for sure.
Yeah, and I actually. I used to think I used to be scared of that, but actually I realized I really do love it.
Yeah.
And I do like to see the same people instead of.
So nice to see. Well, just like when you really know the patient, and like they come in and you're like, wow, you actually seem very sick, like it's nice to actually know their baseline and know
yeah. And it's nice to, I don't know, I just like getting to know people, and it's just nice to, you know, in the ER, there's literally no way these days that you can spend more than, say, 5 or 10 minutes in a room. At
Yeah.
least, you know, at least not outside of resuscitation or some drastic, like, you know, like there's a snowstorm outside or something in Louisiana. Okay. So, you know, it just, you get tired of, I got tired of, you know, having 3 minutes to say, you know, the important things and find out what's going on and never, I like actually getting to know people. So,
Yeah, I love that.
and you know, like I have a lot of trans patients, and like just seeing the progress of their journeys and stuff, and it's like really rewarding in like a way that hey, Laughter, how are you? So, but it's just really rewarding to actually get to see that progress, and I never got to do that in emergency medicine. So I guess I'm
I love
making up lost time. So I actually do more work than I probably, maybe 5 years from now I'll slow down, you know. But
nice.
so but so so you wound up getting monkeypox.
Yeah, that happened. So yeah, I can just kind of tell you like how it started and what went on. It's really, honestly, it's been a really eye-opening experience. So it was 2 weeks ago, Wednesday. Like tomorrow will be exactly 2 weeks. I woke up and just had like painful, swollen inguinal lymph nodes, and I just like I was showering and I was like, wow, these feel like definitely tender and painful. And so I just assumed I probably had an STI. I was like, that would be the most easy explanation. I'm sexually active. And so I went to work and then I got swabbed after work just for like routine testing and was like, I'll just wait and see what the results come back. I didn't do like empiric treatment or anything. And then I otherwise felt like perfectly fine, honestly. And then Thursday, same thing, but started getting like cervical lymph nodes as well and like a little bit of a sore throat. And then Friday, it was like a really, really hot day. I had the day off work and was with friends, like drinking in the sun, and it was like super hot out. And I felt very, like, I was, like, getting, like, sweats and stuff, but I just thought it was hot, and I felt very tired. And I was just, like, attributing it to the weather and being out in the sun. I'm not really, like, a napping person, and I, like, came home and, like, really needed to nap. I was with my friends most of the day. And then got home in the evening, fell asleep, and woke up in, like, a sweat. So I got up to take a shower and I looked at my back because like I like felt like a bump or something, and I had broken out into like several lesions at that point. And so I took a few pictures of them, and I was like, "There's no way this is monkeypox, right?" Like we were hearing about it, you know, like you were posting about it like very early on, but I was just like, it's in the news. They're saying there's like 5 cases in like the whole state. Like I was like, there's no way, right? So I sent a picture to like 2 of my best gay doctor friends and was just like, no context, just like, I have swollen lymph nodes. What do you think about this? Because they didn't want to like plant the seed like, oh my God, is this monkeypox? You know, you can get like that bias if somebody prompts you with the diagnosis, you know?
Thank you, Carly.
So they both of them were like, oh, I don't know, maybe molluscum contagiosum. Like, and then I, like, after talking about it, I was like, I'm kind of spiraling and thinking about monkeypox. Like, what do you think? And then they're both like, I mean, it seems really unlikely. Like, I wouldn't, like, sound the alarm too much. But then, like, just as the day went on, I started getting more and more. So I developed this one on my face that's like pretty much gone now. There's just like a little dot there of where it was, but it grew there. And then I got several on my neck. One was on my bicep, but that's gone as well now too. Most of them are gone. I had this one on my wrist that's still here, but it's like pretty much healed.
Yeah, I remember seeing your videos and thinking, wow, that's exactly what I expected them to look like.
Yeah.
Actually.
Yeah, so, and like the day that I was out with my friends, I didn't have any of them. Like the spots kind of came on like really quickly. So, because like somebody put sunscreen on my back, and they definitely would have noticed if I had like these big lesions, and said nothing. And I even asked them, like, "Did you notice?" They're like, "No, like I didn't see anything." So it's kind of bizarre. So I didn't know what to do. I was like reading on Up to Date of like, what do I do about this? So just like, I'm just gonna go to the ER because like I'm feeling like chills, sweats, like whatever. So go to the emergency room. The emergency provider also was like, I haven't really seen much of this. Like, let me, like, I don't know, like, what do you think we should do? So it was like kind of like a collaborative effort. And then, so called the health department, called the infectious disease doctor, and they just said to like unroof some of the lesions, took a PCR swab. They ended up admitting me actually, which was kind of strange, but only for like 4 hours, and then like sent me home. Um, an interesting tidbit is that I incidentally also tested positive for COVID, uh, which is strange, and I wonder if I wonder if that like played a factor in like if my immune system was
Well,
down.
there's some. It's funny you mentioned that. There's some evidence that it it produces the oh God, how do they put it? The thickness of the mucosa in your nose, and actually makes it easier for viruses to cross. So I mean,
Yeah,
that
yeah,
kind it may be that it physically makes us more susceptible to that, and that's to me would make a lot of sense.
yeah,
But the thing is that sticks around after COVID too. They found so there may be something to that. Everyone saying that wondering if it suppresses the immune system. It just might be a different mechanism
yeah.
than we were expecting, and I don't know. Um, and Laughter and Light says it does cause immune dysfunction, and she's like the smartest person on TikTok. Trust me. So, um, but,
so yeah, that was that, and then they discharged me home. They contacted. So I had two sexual partners in the previous 2 weeks. Both of them have been completely fine and no lesions, which is interesting. They both were offered the smallpox vaccine and got it. Um, so it's not thought that I got it sexually, which is interesting. I truly don't know. I had been like out at the gay bars and stuff, like some crowded events and whatnot.
I mean,
But
it's been surface contact too. I mean, if you think about someone just leaning with their, arms up, forearms up on the bar or something like that, and if they have lesions like, there, and they, you sat down at the bar next.
yeah,
I
yeah, it's
mean,
really, I
because
mean, it's,
a lot of people have been saying, that this one's a bit different from. Because it'll sometimes lead to localized outbreaks or just lesions in one area. But to me, if I would suspect that would be the ST, not the, it's not a, not the, it's not an STI, but the STI-ish transmission, like the skin-to-skin contact. And I think that maybe I don't know, this is just me thinking aloud, is that
yeah,
people with the classic presentation probably got it from a surface or some other classic way of getting it.
yeah, yeah, I know. I wonder that as well. Because so, like, I've obviously been very like public about posting about having it and stuff, and so a lot of people have reached out to me, like who have it in different countries, just kind of saying like, "Thank you for sharing." Like, I didn't know what to do about this, and like just kind of talking through like their presentation. And it's like common trends that I've noticed. I mean, everyone that's reached out has been a gay man as well who went to like some big event, and that has generally that's our culture. We have these events that have a lot of people at them and a lot of hugging and close contact and whatever. So but a lot of people are interestingly having proctitis associated with it.
Yeah, I saw that. I read that first published case report too, which is quite in depth.
Yeah, I read it too.
Curious to hear an account of a different account of a presentation of monkeypox. That's actually a really interesting one. I thought about making a video on it, and it's still open on my web browser. I just haven't gotten around to it because it's been a busy week.
Yeah. So someone asked, what is proctitis? It's a good question. So proctitis is inflammation of like the part of the anus or rectum. And what it causes is like severe pain with bowel movements and feeling like you kind of constantly have to go to the bathroom and feeling like you can't empty, which is a really uncomfortable feeling. I actually had this myself and it was terrible. Like, honestly, for like 4 or 5 days, every time I had to go to the bathroom, I like wanted to scream. Like, it was like really, really bad. So that has resolved, thankfully, but that's like been the worst part for a lot of people who've reached out. They're just like, when is this gonna feel better? Because like some of the spots are quite painful. I had this really big one on my hand that was like, it's pretty much gone now,
I
but
see.
it was like a big, honestly, like mountain. And anytime I was just like touching anything, it was like super, super sensitive.
You'll have to mention that monkeypox in animals also has got complications associated with it. So that it's. I wonder if in the past, some of the things that I wondered about this is that first of all, I wondered if they published the R naught as between 0 and 1, which it's been apparent from the very beginning that that's not the case. Okay, it looks to me more like it's probably like 1.5 or something like that to be able to be spreading like this. But
Right.
the thing is I'm thinking that they may have based that off of data that was taking into account herd immunity. I mean, that was done during the period of the smallpox vaccinations. And to me, I was thinking that, probably there's some contamination from herd immunity that actually reduced the R naught. And what we're seeing is actually the true R naught of monkeypox.
Yeah.
Spreading in not a completely virgin environment, but a near virgin environment. So.
Yeah, well, that's the thing is a lot of these events have all young people who are not vaccinated against smallpox, so there's really no protection. And with the lagging in the test results, I think that's been like a big issue as well, because like a lot of people aren't really that scared about it because they're seeing on the news there's like, oh, only a handful of cases, like it must be super rare. Because honestly, when I was first thinking I was having it, I was like, there's no way I have this. Like, there's 5 people in the state of Illinois. Like, what are the odds that I have this, But obviously, it's spreading. And even when I went to the emergency room, the doctor, the infectious disease doctor who saw me said that she herself had seen at least 5 cases in the preceding week, and that's just here in Chicago. So, like, there were still
there's too many countries that all of a sudden have it. There's too many states that all of a sudden have it. I also, for example, I have I think it's been spreading at least for a year or longer in the U.S. and probably longer than that, probably 2 years in Europe, I'd imagine, to saturate that many countries like that. Because I mean, the R naught it's higher than 1, but it's not that much higher. Otherwise, you get like if it was like if it was like Delta or something like that, it would be overrun with that right now.
Yeah.
So it's enough to self-sustain and increase over time, but it's not enough to overwhelm.
Yeah, that's what I think. It's going to kind of just like mill about and just be kind of spreading between low numbers of people for a constant basis, unless we start honestly vaccinating significantly, which like I'm wondering why that's not happening yet.
I wish we would start at least doing voluntary vaccinations. Because the thing is we need to up armor against this anyways. Because you know what? This one is the West African clade, and it's not really as lethal compared to. But I mean, what if the next time's the Central African one? That's a 10% mortality rate, and if 10% of people start dying, that's. I don't think people really comprehend what would happen with them. Say, well, our chances are 9 in 10. Well, if you subtract 1 in 10 out of, say, in a city, that city's infrastructure will collapse. There's not going to be enough people to do jobs or anything.
Seriously.
So I got one person's asking, do they treat you with any, and I'm curious too, do they treat you with any medicines for this or while it was going on or?
They did not. The infectious disease doctor kind of talked through options with me. If I stayed for admission, which I really did not want to do because I didn't know like the length of time and whatnot, and like I was stable. There was an IV option of like an antiviral. And then she did say that there is an oral option as well that they could prescribe me. She said really she would only recommend it if I had like if I was immunocompromised or I was having like a really bad outbreak in like the genital region or rectal region, which was not the case for me, to try to kind of prevent severe progression. I'm not really big on taking medication in general, which people are always like shocked as a doctor that I say that, but like I would rather there. Sorry. Um, I would rather just let my body fight it off. Like I never really get sick, so if my immune system can just take care of something, I would rather that because the medicine she said is kind of like it's not officially approved for monkeypox. It's like a smallpox medicine, so it's still considered experimental. And I was like, I would rather
I think
just
it's like called Monkeypox or something like that. I know there's Sofotavir, I think, is also, but I think it's an IV one that treats it. Monkeypox is the oral one.
Yeah,
I don't know about that other than the name because it's an easy to remember name. But you know, I did wind up actually based a bit on seeing your videos. Actually, I did go and learn actually how to test for them and made that into an instructional video for healthcare providers. So I made a playlist for monkeypox on my page. So
great.
But it's harder than to find that information. I actually had to, I did wind up getting a contact that worked in the CDC who actually sent me direct links to that. But it's actually, I tried to find it from outside. It's actually quite hard to find the instructions on testing. So
it is. That's the thing with this. It's like the information is really not readily available. Like similar to you, I read that case report. There was also a study with like an N of 7 over the past few years about like a few cases that talked about like how long they tested positive for in like the respiratory PCR as well as like active lesions and their recovery in the different cases, which I thought was interesting. But yeah, there's just not a ton of data. And it makes me think that like we need way more, like I feel like they should be enrolling people who are positive in a study to like be doing swabs and blood work on a regular basis to
and I've tried to find out how long does it last on surfaces besides likely greater than 12 hours. I haven't actually been able to find an answer, and I mean I've probably looked now at like 50 web pages for that.
Right. I know.
I mean it's almost impossible to find decent information. I think that's because monkeypox when they wrote the textbooks on this one, it was an afterthought. It was basically like, well, this is like smallpox's wannabe, like, junior woodchuck little brother, and they basically just said, well, this kind of like pretend smallpox, and it's not that dangerous unless you're like a baby or something. So we're just, let's just say that it's just, it's got these characteristics, because it's a little frustrating, but
it is because like there really hasn't been a ton of guidance. Like, I mean, my only instructions I received was like, you are at risk of spread until all of your lesions have like scabbed and fallen off. And it's
I love to see the ED discharge instructions on that.
Really though, I know. And I was just like, it's a good thing like that I am a doctor and relatively informed because like, I don't know, like a lot of people could just be out back in and not knowing like what's appropriate, like this to some people might look like it's pretty much healed, it's a scab, but to me, I'm like, oh, I still probably shouldn't be around people until that's gone, So I don't know. It makes me anxious, especially with it being Pride Month and there being like all these big gatherings, and we'll see. And the long incubation period is also like a concern, because people are just out and about.
Because and they have confirmed that there is at least. There has been the 99th percentile for the current outbreak incubation period is 19.5 days. So I mean they verified that there is I mean, there have been people who have gone 19 days and been still and then showed symptoms, which, I mean, you can do if you're not conscious about, like, or say you got unlucky from a low risk contact, like, like the elbows on the bar type thing. I mean, you could go and you know uh, and then say you went back to wherever you're from, and then you did a little yard work and you broke out with some poison ivy or something, and there was, you could actually, go to the pool and spread that while sitting on the lounge
Really?
chairs, or,
Really?
or, some other high contact area. And it just, this is like set up for a summertime nightmare, to be honest.
It is. It really
You know,
is. I mean, I feel terrible. So I'm coming up now on almost 2 weeks since illness, which is not 19 days yet. And so, like, the friends who were with me the day before I got sick, this whole time, they're just waiting, like, did I get this? Like, they all feel fine, but how are they to know, Like, none of them were, like, putting their body against me, but we did spend the day together. We
yeah,
were,
I mean, how often do you, just casually, just bump into somebody, or, you just,
or just put my arm around
you
someone.
brush your, somebody brushes this part of, yeah, which, in the summertime, and almost every single person, is almost guaranteed not to have clothes on their elbow.
Right.
At least not unless they're psychopaths, or,
Yeah.
I don't know, aliens or something. I don't know. I don't know about y'all, but it's been about like 105 degrees every day down here. So
It was reaching 100 here today in Chicago. I mean, I've been cooped up in my one bedroom apartment, but I hopefully will get out. I'm thinking possibly by the weekend I'll be fully okay, which will be nice. I'm ready to be released.
I could imagine, and this is a nightmare for, like, people who, don't, like, say, wouldn't have, like, who aren't doctors, because, I mean, who's got, a 21-day quarantine? Then if you get unlucky, another month of sick time, I mean, that's like, yeah, this, there's, there's no way to financially survive that.
No, I know. I'm very grateful that I can do telehealth because, I mean, number one, like finances. Number two, I would just be so bored. Like, I'm such a busy person, and even telehealth is like much less busy than my usual work day, and I'm like pulling out my hair, and I'm still keeping relatively busy. And also, I'm so thankful that there's like all the delivery services and stuff that I can get, like all the necessities that I need, because it's a good thing that this is happening post-COVID when like all of these things have been adapted.
No joke.
Yeah.
Can't imagine there's got to be somebody who's has this in like a smaller town or something like that, and is just about ready to
Yeah.
just go crazy. And I noticed today the U.S. We haven't posted our numbers today, but I did notice that the international case count rose by another 300, which is, it looks like it's been been rising between around 10 and 20% every single day. Like, it's like compound interest rising still.
Yeah, I thought interesting that like Canada actually has quite a number of cases.
Yeah, UK added over 200 today.
Yikes, that's not great to hear at all. Are they vaccinating much? Do you know?
They are vaccinating. I know that they are starting to vaccinate. I know Canada is. Canada's
Yeah,
holding clinics to vaccinate high
Toronto.
risk
I was like,
people.
so I'm Canadian. I don't know if you know that. I'm from like the Toronto area originally. Now I live in Chicago, but I'm so proud of them. Like they were giving out the vaccine at Steamworks, which is like such a brilliant idea to do it like at a bathhouse where like there will be gay people who are high risk coming through, and just having it available, because that's what we need to be doing. Like, a ton of my friends have asked me, like, where can I get the vaccine? And I truly don't think that it's accessible here at the moment unless you had exposure to someone, which is really unfortunate.
Yeah, Miss Bubbles, the number I saw for your stat was actually approaching 400,000. But anyways, yeah, no, somebody mentioned the how many preventable deaths are from COVID. You know, the worst thing is I think that right now, I don't think we're gonna look. I don't think we're gonna get this under control. I think it's gonna be it's gonna be. It's not gonna be a pandemic. You know, I don't think it's gonna be like
Yeah,
everyone,
there.
in waves of it. But I think it's gonna be constant, persistent, numerous smoldering fires. So.
Yeah, that's what I'm predicting
and
as
and
well.
it frustrates me a little bit too that they're pigeonholing this as a gay disease because I mean, yes, it took hold in the gay community, but that the thing is I mean, I could see a little kid rolling around on a lounge chair at the pool, you know, and causing a super spreader event there at a kid's birthday party, just as easily as as what we've had so far.
Yeah, that's the thing is like, yeah, so it's mostly within the gay community. They did actually specify that not all of the people who have it in Illinois are male at the moment.
Yeah.
But the reason is because like so many gay men actually only interact with gay men. Like honestly, the majority of
Well,
my
yeah, I mean, the LGBT community, as a general rule, is pretty tight knit, and yes, we do tend to also congregate within our individual things.
Yeah, exactly. So it makes sense that like a few people had it and went to this, and now they've dispersed into other gay
Yeah,
communities. Because I mean, honestly, most of my social life is just around gay people. To be quite honest, like I don't like. I mean, when I go home into my family, of course, it's not. But most of my life in Chicago is like that. But yeah, all it takes is exposure to one other type of person, and then it's going to be spreading significantly. So, yeah, I don't know. I'm trying. I think like the main purpose of me sharing was that I was like feeling like it was being very underplayed. And
yeah.
number two, even as a doctor, I felt very uninformed about it, like really. And I should be informed. And so I've had a ton of like providers reaching out that said, like, because of my videos, that they like recognized it when somebody came into their clinic because at early stages, honestly, it's not super recognizable. Like as it progresses, it's like, okay, this is obvious, but I could really see it being dismissed for like folliculitis, molluscum, like a few different diagnoses.
Chickenpox, yeah. Funny thing is, I remember hearing about a colleague mention something about there being a chickenpox outbreak in New Orleans like 6 or 8 weeks ago. I wonder if that's actually chickenpox.
Yeah,
you know.
that's really interesting. I didn't hear about that.
Yeah, and I I've heard a lot. People send me a lot of stories too. I mean, I don't know. I guess I've always just accumulated information easily or something. But like I know I have one follower that who was highly educated who sent me photos and full medical info, and I am very convinced that she had monkeypox in January, actually. And I think
Interesting.
probably provable as there's a tissue sample and a vial of blood from that time that was drawn and frozen, I think, at Duke. And they can probably test for antibodies, I'd imagine, if at some. But this person like documented the progression of the lesions and everything, and it looks pretty spot on.
That's
And
very interesting.
yeah, she was like on all like antibiotics and antifungals because of an immune compromised condition, and like antivirals, and was tested for everything except for monkeypox, and everything was negative, including like shingles and molluscum and all that, and all that, all the other
Had
things.
she traveled somewhere strange?
No,
No.
no. I mean, that's one of the reasons that I'm very convinced that this has been circulating for some time.
Yeah. Interesting.
And this is somebody, and not only that, but there's videos made with timestamps from the time it was occurring that independently support the timeline and the other pictures that I saw.
That's very
So
interesting. And
I
is
spent
chickenpox
some
that?
time trying to find out if there was a way to verify this because it would, being able to prove that with a confirmed diagnosis in January would actually redefine the narrative as
Really?
far as, but I can't find any way to do that. The person's willing to do it too.
Hmm. Yeah. I wonder, so you mentioned that chickenpox outbreak, like were they just diagnosed, like clinical diagnosis for most of those cases, or were they like actually swabbing lesions? Because it's strange. Like I
I
thought
don't know. This
chickenpox
is
wasn't even
something that was
seen
mentioned in
much.
passing, and it was right before. It was like a week before the monkeypox story got onto my radar.
Hmm.
Um, which it got onto my radar when there was 5 patients in the UK that had it. That
Yeah.
was when I first noticed it.
And here we are.
Yeah. So
Someone asked, is there a medical name for monkeypox? Which is a good question. That is the medical name at
yeah,
this point.
that's
I know they're
really neat.
talking about renaming it because it's kind of cringe sounding, to be honest, but
Yeah,
there's not been an official rename yet.
yeah. I'm
Hmm.
kind of curious what they're going to picture what they're going to put as the rename.
Yeah. I'm just scrolling to see if there was any other good questions that we should.
Yeah, I got. Are they bigger than chickenpox? Yeah, they do appear to be a little bit bigger than chickenpox
I
lesions.
would say so, yeah. They're more pustular looking than chickenpox as well. Like some of them did have some like significant
Yeah,
discharge
they
coming.
look like if like they got infected, like chickenpox lesions got infected, is what they always looked at like to me.
Yeah, yeah. Like the one on my hand, like I don't know if you saw the picture that I posted of it, but it was like a significant like mound. Like it looked like it could just like be popped, like a big like Dr. Pimple Popper style kind of thing.
Yeah, pull up.
A lot of people are also asking about reinfection, which I have been having trouble
Oh
finding good
yeah,
information on.
I haven't found reliable info, but I have found information that the prevailing theory is that you would get lifelong immunity once you had it. So,
Let's hope so.
and that goes with most of the other pox viruses too. I'm not, I
Yeah,
mean,
that's what I
that a
thought, but
pox at the end of the name generally isn't something that people get more than once. At least as far as the primary infection. Now, whether or not it has some reactivation thing like shingles, I don't know. I don't think anyone knows that, but.
yeah. Yeah, and a lot of people are asking about the vaccine as well. So, yeah, what I have read, and feel free to chime in, is that they're saying it's about 85%
Yeah,
effectiveness if you are vaccinated against smallpox for protection from monkeypox. So, not 100% that you won't get it, but if you were to get it, then you would have a pretty mild case, is what's kind of suspected, is what I've taken out of it.
and we actually if hey, Laughter, if you have any stats that prove anything that we are saying wrong, please feel free to chime in. So she's an immunologist and actually just about stays is as good at or better at staying current than I am. So
Love that. And then a lot of people are asking about like the correlation between chickenpox, shingles, monkeypox, which I did include in one of my videos. It is not correlated. They are different viruses. Um, chickenpox and shingles are related, but monkeypox is
yeah, there's
not
no
related.
immunity crossover either. So it'd be nice, but the shingles vaccine and the chickenpox vaccine will not give you any protection.
Yeah, because interestingly, I have personally had both I had chickenpox as a child, and I had shingles like 6 months ago, which is super weird. Like I'm 31, I'm healthy, I'm on no medications other than PrEP. I was under a lot of like stress and like not sleeping well, and I just had like a random shingles outbreak. So it's very strange, but obviously having both of those has not given me any protection against having monkeypox.
One of the things that I found interesting is that you can vaccinate after the fact with monkeypox, which I've been some of the things that I've read that you can do it up to 14 days afterwards in some cases. That the later you do it, the less effect it has, but you might be able to attenuate the actual severity of the disease if you get vaccinated up to 14 days past. Which,
Interesting.
yeah, I mean, I guess that's there's not too many diseases that I'm aware of that follow that. Besides, like, I mean, I know you like, I guess rabies is like that, but you know, but not too many diseases you can vaccinate after exposure and have it meaningfully
So
do
they're
anything.
saying 14 days after exposure, not 14
Yes,
days like
not
now.
after.
Okay. Yeah.
No, I don't know if the counter stops when you start getting symptoms, or if you could still do it while symptoms are.
That's basically
You
what the
would,
eye doctor said to me. Like, she was like, "You already have the rash. The vaccine isn't really going to prevent progression at this point because it's a 2-dose vaccine, right? Spaced by 28 days.
yeah.
So it's really not. If you started it that late, it wouldn't really have much effect during the course of the illness." A lot of questions that people are asking, I can see some of them in the chat as well, is like, how risky is doing blah, 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 like taking public transit, going to whatever, a restaurant? And like, there's not really a perfect answer to any of those types of questions. Of course, the only way to prevent yourself from getting any disease is to never leave your home. Is that realistic? No. And so there is some risk with anything that you do, So just being vigilant and washing your hands and minimizing contact with other people when you can and using hand sanitizer, just doing your best to protect yourself. But really, like, everything in life comes with some degree of risk, right?
Yes, me and my side just goes, I'll just wear a hazmat suit. Trust me, I know how you feel on that. One thing I can say that is if you're using public transportation, maybe, wear, jeans instead of the skimpiest shorts that you have, because honestly, while you can get it through, if you get it on your clothes and then secondarily through exposure, but it's a lot harder just by the nature of, say, you'd have to contaminate a surface as an intermediary and then contaminate your skin and have a break in your skin. So if you actually were sitting on a public seat, like, and I'm thinking a hard plastic seat or something like that on, say, a subway or something, it would make sense that if you had a barrier of cloth in between, that it would maybe attenuate your chances of getting it some.
Yeah, absolutely.
And for the people who are asking, the airborne way is really very difficult to get. You have to spend at least 15 minutes in close contact with them because it's droplet spread. It's not aerosol. It's not like COVID. And you have to be close, usually within about 10 feet for that to work. So, I mean, 15 minutes or more within 10 feet of somebody, and you can actually stop that mode of transmission with just any mask. A cloth mask would work. So we don't know how long it goes on countertops. No, there's no good answer available. It's more than 12 hours, but other than that, I can't tell you.
I know, and I hate that because, like, I've obviously been in my apartment for 2 weeks with these sores and sitting on all the surfaces and making meals and I'm like, okay, at what point can I, like, have people over again, Like, what?
Yeah, I'd imagine probably, I can't fathom that it's going to be more than 48 hours, though, okay? I mean, there's very few things that aren't spore-based that can stay for more than 48 hours and be a legit infectious risk. Candy Mom, yeah, straight people can get monkeypox. This isn't a gay disease. This
They
is
sure can.
spreading in the gay community. It's not a gay disease, though. It could just as easily be anyone in this audience.
Yeah, diseases generally don't ask you your sexual preference before infecting you.
Sorry, there are certain questions that I like to answer real quick because really, yes, kids have gotten monkeypox. Okay, there was a kid in Great Britain that was hospitalized in critical condition at the start of it with that. The kid did recover, but it was a child, I think, around the age of 6 or 7.
Mm-hmm.
So, and there are kids that actually have it right now.
And that's what would be honestly even more concerning if children start to get it more, like more and more children, because kids touch everything and touch each other, and like I'm just thinking about like public parks and like playgrounds and
and that kid rolling around on the slide, which
yeah.
And then 700 other kids slide down that slide that day.
Mm-hmm. Yeah, I do think there's been obviously certain news media outlets who have not portrayed it as well and are like contributing to this like gay stigma, like Marjorie Taylor Greene or whatever. But there's
really,
some, I don't know.
To drop her in a volcano.
I can't deal with her. It's ridiculous. But there was like, I thought the Daily podcast by NPR, I don't know if you ever listened to them. They did a really good episode. It's like a 20-minute episode. It's like very straightforward and clear cut. And I thought they did like a really good job explaining like transmission and why it is more in the gay community at the moment, but like not doing it in like a stigmatizing way, which was nice to see.
No, that's good. We need more of that. And I've tried to make sure that that's in any of the videos that I make about spread, and modes of spread, because I don't. We're not going to relive the 80s on this one. That's just not going to happen in no effing way. So,
and I have some fear of that. Like I obviously, my friends have been super supportive, and like majority of people online have been like very like happy that I've been sharing and stuff. But I do worry, like as I start to go back out in the community, if people are going to make underhanded comments of like, "Oh, can I touch you?" and like stuff like that, and like just like stigmatizing having it. So I really hope that does not happen, but would not be surprised if some people make some comments of that nature.
Yeah, I hope that doesn't happen.
Yeah.
Because that'll just wreck faith in humanity.
Yeah, I mean, that's why I made that one video about like calling out that one person who said if you didn't act like a wild animal or whatever, because people say rude shit like that, and it's so upsetting. Like, let's not shame people for getting an infection. It's an unfortunate circumstance. No one wants to have it. No one planned on having it. And these things happen, and why don't we just help people get well and support them rather than making people feel bad? It's the same with infection.
And everyone in the audience, if you see people saying that kind of stuff is misinformation, put down something like that is not how it's spread, or that is misinformation. You don't have to get in a fight with them or say profanity, but do counter those kind of statements.
Mm-hmm.
We've got to make this different from the early 1980s. We saw how that movie went. Okay.
Sure did.
And we're not doing that again. So, but it's going to take crowdsource effort on that. It's not, we can't make the videos ourselves forever, eternally, over and over. We're going to need a little bit of help from people when you see those misinformation things, when people going, well, it's just a gay disease. If you're not gay, you don't have to worry about it. Countering that is not true. Non-gay people also can get monkeypox, and it is not an STI. It's spread by skin to skin contact. Things like that. Those kind of things. And if people start doing that too, that also people see that on one of those ignorant remarks, and maybe if they were thinking about doing their own ignorant remark, maybe they'll shut up because they don't want to be all of a sudden realize that they're the focus of all of the negative attention.
Yeah, I agree, absolutely.
So, but yes, and if there's a official news source that's publishing articles that's saying that, send those to me. I'll find some way to either correct it or blow it up. Okay, I don't have a whole lot of that barrel that was labeled initially with fucks. I got crossed out, and it's just got pennies in it. So, I don't know where the fucks went. They're gone. So, but no, just having, I spent all of COVID, trying to fight that misinformation, and by the time it was we let it go so long, it became so well entrenched that it was just impossible. So
Yep.
this time, I really want this to be different. We might not be able to stomp it out efficiently because, I think we're guaranteed to screw everything up. But, let's at least not have the misinformation. I hate that.
Ideally, yeah, it's hard in this day and age, though. Like, people can just make any claims on the internet and feel like that makes it fact. And it's great that we have like creators like you and I that have the credentials to actually be like, no, this is not correct, and this is the real thing. You just hope it's tough because people get so caught up in their own echo chamber and they only hear the things that they want.
Yeah, another great way to counter that is just post source, please.
Yeah, absolutely.
So, and yeah, Paula, I know that Delta's back. I'm the one that made that video. So.
The Delta variant of COVID?
Yeah, the Delta Plus variant, at the beginning of the month, there was 40 cases in Britain, and on June 16th, it was up to 460 cases.
Oh, yikes.
So, yeah. That's not the best news.
Not the best at all.
But now, if you're Goddess, if you're boosted for COVID, you're in good shape against Delta.
Yeah.
But only 1/3 of the U.S. population has been boosted now. Okay, and it's been long enough since the original vaccinations that the original vaccinations have waned to the extent, and especially if they only had Omicron since then, that that person would actually be susceptible to a Delta variant, because Omicron, immunity to Omicron doesn't necessarily, it doesn't seem to translate to immunity to anything really except that same strain. So boosted meaning any degree of shots. Okay. After the first two, y'all. So, but we're still gonna keep, also talking about the monkeypox, y'all. I just wanted to answer that one question because that was kind of a hot topic this weekend. Because
I think on the topic of vaccination, like, do you think there's anything that we can be doing to advocate for administration of vaccinations? Because I really do think that's what the right thing is to do.
Yes, I think we need to, number one, we need to take some of those a few million of the 100 million smallpox doses out and offer those to people over 50 who have already had it and don't have eczema. Because that'd be a great, easy way to refresh that immunity in a population, that would be receptive to generally, the over 50 crowd generally does tend to prefer to get vaccinated against something like smallpox, because some of them, they remember how that was. They know that, they know it's a threat.
Yeah.
So, we could be doing that. We could be, doing voluntary vaccinations for healthcare workers. So, and we can be doing voluntary vaccinations at places like, STI and PrEP clinics and stuff like that.
That's what
we could be doing that right now.
For sure.
And we're going to need to do this because eventually this is small. Monkeypox doesn't mutate as fast as COVID does, but it still does. We've got two distinct strains in the U.S. right now.
Yeah,
and there's definitely been changes with this one, especially with that local outbreak. The lesions, the local outbreak version that has never been seen before with this disease. So there are genetic differences for certain on this.
For sure.
So. And eventually, like I said, eventually the Central African clade, the one that kills 1 in 10, will get out. So we need to have some armor against this. We maybe don't need to do, a COVID level vax drive, but we should up armor a bit voluntarily, because this thing, is a clear and present threat to humanity.
Yeah, absolutely. And I think a lot of the the people who know they would be at higher risk would be very happy to get the vaccine. I know like a number of my friends are like, where can I get the vaccine? And someone just commented that actually, how can we access the monkeypox vaccination? Which, so just to clarify, it's a smallpox vaccine, not for monkeypox.
Joan.
But you can't really get it voluntarily in, as far as I know, in the U.S. at the moment. Like, so all they're doing is just contact tracing for direct exposures to positive cases and offering the vaccine to those people.
They're ring vaccinating, and while that's a legit tactic, for the individual members, which is because how I think of this is, we need to be going beyond that, because this isn't. If you look at this, in the long term, the outbreaks of monkeypox in Africa have been, in the 70s, 80s, and 90s, there was virtually no cases. 2000 to 2010, there was there was a good amount of cases, and this 2010 to 2020 it more than doubled. So that's because the immunity is now waning. It's all in the older people, and so we have to do something to rearmor. Otherwise, this is going to get out, or or I don't know, Putin will play with smallpox or something like that. And we've got to have some armor present against these things. We can't just stick our heads in the sand like, this problem is just no problems with it. It's nothing to see here.
Yeah. I mean, especially for how long the illness lasts, it's like it's going to be really hard for people to isolate for that period of time, Like it's not realistic, and people are going to be breaking quarantine and spreading it because it's just not okay for most people to stay home for that long.
Yeah, and we can't, because that's going to be a catastrophe if this becomes a generalized thing. It's going to wreck lives financially. It's going to destroy the economy, and everything that's, it's going to shut down everything that's, contact based. Okay. So all public swimming pools, water parks are all going to have outbreaks. All gyms, massage, spas, massage places, anywhere that does, manicures, pedicures.
Yeah.
I mean, the ability for this to totally, fuck up society is, theme parks. For this to totally fuck up society is as high as COVID, as far as like its danger to our, what we think of as, our way of life and things we want to do.
Yeah. I know. At this point, I do not think I have spread it to a single person, thank God, but I'm still in that incubation period, so we will find out.
Well, hopefully not.
Yeah.
But then again, you get the award for probably the fastest recognition possible that somebody could have done, without, when you came down with it. I mean, that was
very early, yeah.
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 So, but it's I just hope that I just wish we were doing anything that was disaster planning oriented. I did a fellowship in EMS and disaster management, and it included pandemic planning, and
cool.
And where I would be handling this a lot differently.
I know. I mean, is there any kind of like task force or, because like that's something that I've been wondering. I'm talking with this one guy in London who has it, and he's part of like some monkeypox like response team there, and they're talking about like enrolling active patients in a study to do like swabbing to get more information about like really how long you're at risk of spread, and like just polling them about symptoms and whatnot, which I think is super important. And I don't know of anything like that happening here.
No, I don't. I haven't even heard rumor of anything. And I mean, I don't have the world of connections because, it's not like, people are officialdom's beating down the door of like the one trans doc in Louisiana to get my opinion on shit. But, I have a great crowdsourcing network. So, and it's surprising who's in the crowds because there's some very brilliant people and some people that are, highly placed in
Sure.
certain industries. So I get lots of interesting things, but I haven't heard anything. Anything.
Yeah, it's not very reassuring, that's for sure.
So
Trying to think if there were any other like common questions that I'm getting. A lot of people are asking me, like if it's gonna scar, which I think it probably is. Like there's this one here that's like pretty much healed, but it has this like mark. That's what most of them are looking like when they're healed. So it's just like a little bit different pigment. I don't know if that will stay forever, but um, yeah, here's another one that's like completely healed, but you can just see like that's where it was, you know? So I think it's probably going to leave some scars, but time will tell.
I would say that, now this is depressing as hell, but I think what it's going to take is seeing some, seeing like I don't know, say a 14-year-old girl that has it and then has pockmarks all over her face. That's people will probably take it pretty serious after seeing something like that, but it's going to take something that's a slap in the face.
Yeah, because that's what like a lot of people are saying, and that's also another reason I was very public about mine is that like my case wasn't very severe, and a lot of people are commenting like, "Oh, this doesn't look so bad," like it made me feel better. And it's like, well, yes, like I did have a relatively milder case. I'm like a young, healthy male. I like eat very healthy. I have no medical problems. I take care of myself, um, but it still should be taken seriously, even though I didn't have like a severe case, and we shouldn't have to wait to see like really bad cases in order to like jump to action about this.
Yeah, Nurse Adrian in my audience is mentioning a couple other places like prisons and group housing and the military. God, those are just tailor made for this.
So, but I does the military? Because some people have commented, does the
But
military
the
vaccinate?
military does vaccinate for smallpox, I thought, or at least they did at one time. I'm not up to
Yeah,
date on what the military does medically, though, like as far as like what they do. But you know, that's one place that I would, if anywhere was going to start doing some forward thinking as far as that goes. Generally, the military usually is pretty heads up about that because they will they'll do it on their own too without necessarily waiting for the public demand or something because their job is to keep keep their state of readiness up. But so maybe the military won't be the nightmare sense spread area, but the prisons, oh yeah,
what is
that one's going to be a problem.
someone called the happy patient put they are small oozed vaccinated. I'm not sure what that's supposed to mean. They said they work at the VA though, so yeah, I don't know if they are vaccinating or not. But yeah, I also don't know much about what goes on in the military.
Yeah, the military, they did it in response, like they did in response to that. Remember that anthrax scare in the early 2000s where that
Yeah.
dipshit was mailing anthrax to everybody? Like, that's actually, I believe, what started the smallpox vaccination drive in the military because people started wondering, oh, wow, somebody actually did bioterrorism. And they started thinking that, okay, if somebody did that, we're hosed if they did smallpox. So they started vaccinating in the military for that. And I guess they're still doing it from what some of my audience members are saying. So I, to the person asking, Tarrant Square, I don't think we're going to get locked down again for this. This is locking down isn't. It's not so much like something you get at the grocery store. It's something you get at the gym or the theme park or something like
Yeah.
that. You really
Just
need.
yeah. I don't think at all there's going to be lockdowns with it not being like
Yeah,
respiratory.
I don't think anyone has the appetite for that either, to be honest. And even I don't. Okay, I mean, it's only been 2.5 years of this.
I hear ya.
So, I mean, I used to have hopes of living normal lives. Now we're just in some dystopian hellhole.
Yeah, here we are.
So,
All
yeah,
right, well, I might hop off, but I appreciate you
Dr.
having me. And
Thank you for coming on. This was I'm really glad that we got a chance to do this. I learned a lot, and I really appreciate it.
me too. I'm glad we did this as well. If you get any like questions afterwards, or people have personal questions for me, they can always DM me. I'm pretty decent about responding to messages.
Yeah, we usually, yeah, I was going to say, and I think probably usually the guest lives get posted up on my YouTube thing. It only has like 200 people followers on that. I don't ever pay attention, but it's like an archive that I keep like
Oh, great.
the interesting ones on, because some of these like this one and a couple others, like really I mean this, there's some really good information that that you brought to this, and I don't want people to lose that, because.
Well, thank you. I appreciate it. All right. Well, it was nice to connect with you, and I will talk to you soon.
Thank you so much.
No problem. Thank you.
Take care. So, anyway, so it is 8:04, so you have me for another hour. So, what you want to talk about? Well, thank you, Joan. Thank you for the hand heart, and thank you for everybody. Sorry I didn't get a chance to answer questions like I normally do. Y'all know that when I have guests on that I generally give them my undivided attention, because, and well, Dr. John there actually literally had a one in a quarter of a billion story to tell. So, I really wanted to make sure that he got our my undivided attention, because he's probably the only doctor in the world who's made it through that right now. And honestly, the chance to actually get that information was really wonderful. So, but how bad is monkeypox? It depends on. It depends. On paper, it has a mortality rate of about 1%. The problem is it is worse in kids than it is in adults. Thank you. What's your mom doing for the butterflies? So, but, and it also, the West African one's the 1%, but there's one in Central Africa that has a 10% mortality rate. Fortunately, that's not the one that's out of the, off the chain right now, but still dangerous. Any positive things this week? Yeah, I got a call back from the adoption shelter, and my adoption of Lilith and Audrey has been approved, so I'm going to have the 2 kitties. So, sometime after July 9th. So, and I mean, what's more positive than kittens? Domesticatus, actually, no. This one hits little kids the hardest. So actually, people say that this is something that only comorbidities are going to get. No, actually, this hits the under 5-year-old crowd the hardest. So, yeah, but yes, the let's see who was that? Wow, that's a lot of live requests all at once. Have I decided names yet? Yeah, the mother's name is Lilith, and the kitten's name is Audrey Earth. So, but why is it worse in kids than it is in adults, spicy Italian? I'm not 100% sure, but it tends to cause, I know that it tends to cause encephalitis in little kids more frequently, okay? So that's one of the ways that it kills, is through encephalitis. TikTok, the smallpox vaccine, they haven't released it for it to be ordered by physicians without special permission from the CDC. So, so I can't. You can't just get it no matter how much you want. And that's both the ACAM 2000 or the Jynneos vaccine. Okay. Can I show us pictures of kittens? Let me see if I have any on my phone, because I'll show y'all. I love showing off kitten pictures. I do have kitten pictures. This is Audrey. Oh, what the heck? Okay, come on. There. So yeah, Audrey is about to pass out in that picture. She's a tabby. That's the cutest, I think. Anyone who doesn't like kittens says something wrong with them. How old is she? I think she's about 8 weeks right now, 8.5 weeks or so. 8 or 9, maybe 9 weeks. So, yeah, she's such a little cutie. Yeah, Domestic Goddess, by the way, also rescues feral kittens, and was the one that rescued those kittens. So, under the name of Friendly Ferals, and I go watch her lives a lot just to watch little Audrey running around. So, yes, I know. I'm actually cleaning out several dresser drawers because I'm going to move my jewelry into them so that Audrey cannot hide my jewelry. So, I'm actually kitten-proofing my house as we speak. But, hi, Jay. Ben, yeah, I know. Remember, I'm a ER doc myself, and I also run I'm a medical director for a clinic that does a lot of, LGBT care too, and I do also that in my own clinic, and I would love to be able to have the vaccine for monkeypox. I would love that, okay? I have tried to find if I could get it. So, it's not been released yet. I have good connections when it comes to getting things like the vaccines and monoclonals and stuff like that. So, they're just not there yet. You know, the ability to get it's just not there. So, but yeah, there's Friendly Ferals. Anyone who wants to see Audrey and Lilith, follow Friendly Ferals, and you'll be able to. So, plus she rescues kittens, okay? And you can also see those kittens on there too. And we support people who rescue kittens. So, I know, Ben, I've made inquiries also to the CDC and actually even things like DHS and stuff like that. It's not that easy, okay? I have a direct pipeline to where they, like when you get things, like to get things from, say, the Strategic National Stockpile. Like that's how I get oh, thank you, Jay-Z, for the shell. Thank you. So I actually, you know, I get things like all the monoclonal antibodies and the Paxlovid and the vaccines and stuff that I use at my clinic. I get it from the Strategic National Stockpile, and we have a strong connection with that for our state. And I would know when it was available to be ordered, and I would order it immediately myself. So, because I am determined to actually, when that's available, to actually be able to offer that. But yeah, so thank you, Jay. Thank you for the butterflies. So, hey, Butterfly Moonstar. So, but yeah, so I keep my my radar up pretty good for this, and trust me, I will. As soon as I'm able to offer that vaccine, I would obviously not be quiet. So, well, thank you for the hand heart, Mary Stan. So, anyways. Well, thank you, Dreaded Advocate. So, does anyone want to hear some cool news? So, there will be videos forthcoming on this over the next few days. But I'm actually going to be helping and in a docu-series that's going to be coming out. And I'm going to be looking for some people to tell their stories about long COVID as well. It's by, and I made a video about the actual the page for the company. It's called Whale of a Tale Productions. But I'm actually going to be in their docu-series and talking about my journey and stuff during COVID and what my story, and we're also going to be doing stuff on people with long COVID as well, and they're looking for people that are have long COVID and are in the LGBT community or the BIPOC community or immigrant community. To tell their stories. So I'm going to be making those into videos, but actually, yes, if all goes well, I will be in a documentary, and I'm going to actually be doing some close work with them, including helping them promote their stuff. So, because it's an independent film company that is a small independent film company that has their heart in the right place and wants people who don't have a voice to have their stories told. So, and that's kind of something I'm all about. And yeah, Mary Stan, this is how you get the word out for people. This is how you get attention on something, is by making documentaries and stuff like that. And I want this, to help the story, the story of the, people in our communities and such to be able to be heard, and not just with the few people who already have voices would be able to say, thank you, Jay-Z, for the show. So, I've got other cool announcements coming up too, maybe as early as tomorrow. But I've been busy the last few days. That's why I've had less videos out. So, but PrEP and valacyclovir do not cross-protect against long COVID. Whoever asked that question. So I have not seen evidence to that. Now, Ben, I will go look up and see, since if you're saying that you saw there was a study, I will go look up that up and make sure that I'm not giving you incorrect information. But, well, thank you, Camp. So, Gage, I don't even understand what you're trying to say. You're saying that why am I putting over the top look in my face BS? What the fuck are you talking about? I was talking about actually medical stuff. What's your problem? All right, well, those two are gone. Yeah, I already did. Both of them. What's my approach to antibiotic stewardship? Well, I mean, don't treat viruses with antibiotics. That's... as a general rule, if it's clearly a viral illness, don't... I'm not going to treat it with antibiotics. That's just bad. If it's probably, but it could be bacterial and they're not very sick, an option is to give a prescription and say if you're not better by blank, and you can do that. If it's a coin flip or something like that, maybe you recheck on somebody, because see, those are viable things too. Rechecking is a time-honored tradition to be able to make a decision, so you get 2 data points. So, but antibiotics for everybody is not the best thing. So, and I found that if you actually bother to talk to people and educate them and answer questions, that they tend not to be as mad. If you just say, no, I'm not doing that, it's a virus, it doesn't work, and you're in a hurry and you walk out the door, then they usually get mad at you. So... the vaccine and boosters, they prevent you from getting COVID, okay? Now, if you get COVID, you do have a reduced chance of getting some of the long-haul COVID things. So, but the main way that the vaccine prevents long-haul COVID is by preventing you from getting COVID as often as the people who don't have the vaccine, so you don't have as many chances to get that. Brad, my medical director for EMS services. Currently, I have a couple of small urban search and rescue teams that I do, but other than that, no large-scale EMS services, no. So, Milliwags, antibiotics don't hurt good cells, but they kill, they kill bacteria everywhere in your body, and the thing is but they don't kill all the bacteria everywhere in your body. So the bacteria that survive in non-target areas tend to get resistant to that antibiotic. So if they ever become a problem, then they're resistant to that antibiotic, and they have a chance at gaining additional antibiotic resistances to each time. Okay, creatinine, I'll say things about, like, you know what, you've heard of MRSA, or you've heard of people having resistant urinary tract infections and being put in the hospital for that. Well, this is how, it was us giving antibiotics out for everything that made that happen. And now people are actually dying from untreatable infections because we gave antibiotics out too often. And we didn't actually do things like reassess people, or to actually bother to explain that, antibiotics don't fix viruses. So other things, K-creatinine, that work are things like substituting in, for sometimes things like steroid shots and, symptomatic relief. Like, I'll explain, like, just because it's a virus doesn't mean that I don't treat it. Okay, it just means that I can't make it go away any faster. So, I'll do things like give, the cough medicine that actually works, and, steroid shots and stuff like that, because, you do get people feeling better with those things, and that's really what they want. They just don't want to be miserable. And so you're actually doing your job, but just in a different way than they were expecting. So, but, if I were to tell you that if someone were to come to me and say have something that's going to make them feel horrible for 6 days, and they come to me on day 2, but nothing, thank you for the confetti, nothing I could do would make it go away any faster than those 6 days. But, I'd give somebody antibiotics, and they'd get maybe a placebo effect a little bit, but, they wouldn't really feel much better. Or I could do something like a steroid shot, an inhaler for the the tightness in their chest and wheezing, and maybe some cough medicine with some codeine and a good decongestant in it that actually treated their symptoms and let them get sleep at night. They would actually say, well, actually that doc actually kind of kicked ass. Well, thank you for the hand hearts, Leah. So, I would prefer to, and I'll tell them, just because I can't make it go away doesn't mean that that you have to be miserable. We can do something about that. So, and I focus on fixing the stuff that, fixing symptoms that I can make a difference on when it's something that I, like, say somebody comes in on day 3 of the flu, that's too late for Tamiflu, and giving a Z-Pack isn't going to fix anything. So, but that's what a lot of urgent cares do. But strong cough medicine, steroid shots, and if they have a wheezy cough, the inhaler actually, would, and it's easy to write a prescription for, say, Zofran if somebody's nauseated, Well, thank you, Leah, for the paper crane. So, that's what people are looking for. That's how you, and a lot of times people understand if you explain it to them that, you can't make it go away faster. But remember, our job is also to relieve suffering, too. It's not just, it's not just, well, you can't fix the disease, let it rip, no. Thank you, Jay. So, I don't know, Ben, I don't think it's necessarily brilliant. I just try to think, if I was, feeling like that, what would I want somebody to do for me, And I try to do that because, maybe, maybe one day I'd need a little good karma my way, I don't know. So, Mary Stan, no, you have to be licensed in the state the patient lives in to do telehealth, okay? I can see anyone in person, if they come to me from any state, and I can do telehealth through the whole state of Louisiana, but I can't do telehealth on, like, say, Oregon, because I'm not licensed in Oregon. So, it works a little weird. Well, thank you for the lights, Leah. Thank you. So, well, Jay-Z, we're supposed to be doing compassionate care. Thank you, Jay, for the butterflies. So, I mean, it's the first part of that, Hippocratic oath, or the hippopotamus oath, is to first do no harm, but the other part is about relieving suffering. So, and I believe very strongly in doing that. I think that we've kind of lost sight of that particular objective a lot, and I try to do my part to make sure that that's remembered. So, but well, Ben, just just be careful. I mean, you can enjoy yourself. It just just watch the casual contact, okay? So, thank you, Leah. I would love to see Pride in a place like New York City one day. Thank you, Michelle, for the hat. So, well, remember, if anyone in the audience is in Louisiana, or is in Northeast Texas, or Southwest Arkansas, or actually, you can come see me. I have people who come away as far away as Dallas and Fort Worth, and I have people that come from Houston, and have somebody who comes from Nashville, and have someone, I think, next week coming from Alabama. So, but no way, Michelle. So, come from California. So, anyways, H-Dog, well, thank you, Leah, for the Pride glasses. So, H-Dog, the monkeypox update, I actually had that gay doc, the doctor that actually had monkeypox, as my guest on tonight. So, thank you for the hat, Michelle. So, so we talked a lot about that. Monkeypox is going up big time in Europe. The caseload rose a lot today. It rose. It's over 3,000 now, and it was 2,700 yesterday. So, San Antonio, well, that would be fun. I haven't been to San Antonio in a long time. However, I'm not really feeling all that comfortable about, running around in Texas these days. So, because I don't know if anyone saw my video I put out on Sunday about what Texas. Well, thank you for the corgi, Leah. Those were always so cute. So awesome, Jay-Z. So thank you, Christina. So, but yeah, I don't know if anyone saw my video Sunday about what happened in Texas with the Republican Party passes their official platform there, but it's it's disgusting. I mean, it's disgusting. So, I mean, I've been in a bit of a rough mood for the last 3 days because of that. I mean, yes, I knew that that was where they were going eventually, but to actually see them put that down on paper and adopt that as their platform and officially endorse it, my God. I mean, it's a monster. It's monstrous. So, it's how could anyone proudly, raise their flag and say, "Fuck yeah, that's what I stand for," I mean, how could anyone? Thank you, Leah, for the butterflies. I just don't understand how people could have that much official hate, and adopt that as their official platform. So, I mean, it's really... This has got to stop. I mean, for God's sakes, we're people. Just remember, when people are saying, well, I don't know anyone like that, it's people like me they want to get rid of. Just they would accept a lot of the people like me aren't as fortunate as I am to have a voice and a following. But it doesn't mean that they're any less kind to people, We have to get them out of power. We need to dial it back. This from the brink. This is they're on. If that were to start becoming the way, that's fascism. Thank you, Leah. And yes, John, eventually they come after all of us. They'll come for me, the ones like me first, but they will come for everybody. And just remember, that doesn't mean that to stand against that means you're embracing some far left thing. To be honest, when it comes to a lot of things, I'm pretty much down the middle on things. I just want people to be good to each other and watch out for each other. That's Tiffany's platform. But I don't have anything in common with that, people who make a manifesto like that. And yes, Jay-Z, that leads to extermination, those kind of things. That is I don't even have words to sum exactly how I feel about that. I mean, honestly, I have had a lot of trouble. I've been in a really terrible mood the last few days. Anyone who was maybe at my live on Sunday might remember I stopped the live because I was in such a dark mood that I didn't want to just start, getting mad and ranting and raving and, getting banned or something. That's just, to know that just someone that people, it just bothers me that they put that down on paper so bad. It bothers me. We gotta put common sense back in, and common sense is the middle way, not an extreme. These extremes are never the right answer. So, hey Doxy Bear, we just need to dial back the animosity. No one's a lot of y'all have followed me for some time. I've had enough time to, show true colors or something like that. Most people that are LGBT are just like me. They're normal people who are generally, I just, want to live my life. I want to find happiness. I want to help make other people happy. I don't have an agenda. I don't have some trans agenda to make more to convert people to trans. No. If I had the ability to convert people to transgender, I wouldn't do it. That'd be no. That'd be disgusting to do that. I'm proud of who I am, but do you think that I would really pick to be in the most disadvantaged minority in the United States? Like if I had a choice about it? No, I'd rather not lose my job because I'm trans, or have people decide they don't want to serve me at a store. That sucks. So yeah, thank you, Leah. I don't understand how people think that there's some agenda. I wouldn't, even if I had that power, I wouldn't do it. I wouldn't even do it to my enemies. It's not right to do stuff like that. Won't work that day. That's why I think we need to dial it back. I think things like that hate manifesto in Texas, the people who wrote that, the people who back that, do need to go. I think that those who would seek to do the same things on the other end of the pendulum need to be stopped too. We need to meet in the middle. We need to actually just talk things out like reasonable human beings. We've forgotten how to do that. When you get to know people, they stop being so damn alien. You find out that they're not the enemy. You find out that they're just like us most of the time. And I don't know, a lot of conflicts would stop happening if that group would just actually bother to get to know people and drop the hate. I would just need to back it off. They just need to back off on that. And at this point, I don't think that it's going to magically happen. I think that we're going to have to, at least stand our, thank you for the shell. I think we're going to have to at least stand our ground and, make it known that we're not just going to walk away and let it happen. So we're going to have to, do things like protests and stuff like that. Hi, Nurse Messi. So, yeah, wow, it's not a fucking choice, okay? It's no more of a choice than what I am is a choice. And if anyone thinks that, someone in their, in their mid-40s decides that they just want to stand up in the middle of their career and say, hey, everybody, I'm going to be, you're going to call me Tiffany from now on, and yes, I realize that it's going to be a shock to you, and I know I'll probably lose my job and stuff. But, it's a choice. It's just what I want to do. No, I did it because it was unbearable to not be myself. So... User 085, go away now. I don't have any patience for people like saying that right now. Well, thank you, Leah, but now I'm 46. I'll be 47 on July 18th. I'm old as shit. So, Jay-Z, and it's not like, people need to remember that a lifestyle is not necessarily a choice. So, hey, great, hey, great, how are you? I haven't seen you in a long time. So, well, thank you, another plot twist. Yeah, great. Cancers are the best. So, well, thank you, Miss Jones. Thank you. But you see right there, that's like actually, I love the fact that videos and stuff, hey, Otis, how are you? I love the fact that videos that I made have helped people not be scared when they had COVID and stuff like that. Like, that makes me really happy to know that. Like, I I don't want people to be scared. I want people to know that people have their back. No fault, no, I would not. If I could take a pill and make the world so that it would, be okay with, wouldn't look at me funny, yes, I would, but I'm not taking... Thank you for the doc. I hadn't seen that before. I wouldn't, at this point, I am who I am. And thank you, great. And I wouldn't want to take a pill and be like, and all of a sudden, wake up as some random dude or something. No, I wouldn't be. I would still... I'd have to start a new life or something like that. I wouldn't want to even have knowledge of what I'd been beforehand, because I would always know that I would if you knew that you could have your most painful memory erased, but you would know that somebody erased the memory, and that it was a bad memory, would you do it? So, exactly. Yeah, no, I'm sorry. The reason I refer to Kim Jong-un in that video as a fatter version of DeSantis, because number one, they've got the same governing style. Number two, they're roughly as evil as each other. And number three, Kim Jong-un lives in a nation of starving people. Yet, he weighs like a quarter of a ton. He feasts while his people literally eat the bark off of trees. That's where that comment was. Because you know what? I'm all for body positivity, okay? I'm 5'11" and 239 pounds, okay? I'm fat as fuck. And I feel absolutely no sadness about that. But I also am not doing it while people that I'm responsible for leading are starving. So that's where that came from. So I know that, there was a couple of people who were offended by it, but if I offended them, they needed it. Yeah, David, I saw that. I'll look into it as soon as I'm done with this. Expect the next Monkeypox update to be rather interesting, if that's the case. So I was waiting until the U.S. numbers came out because they haven't been updated in some time. But if there's something like that out, I'll put a special quick update out before I go to bed tonight. Hey Linda, how are you? Well, thank you, Leah. No, David, I'll be looking it up as soon as I sign off, so. Yeah, Ruffian, the North Korea is a horrible country. No, we're not. Jay-Z, we're still not doing the amount of testing we need to be doing. We need to be testing, a few hundred people a day. Thank you, Denise, for the garland. We're testing a couple of dozen people a day instead. We're really behind on the monkeypox thing. And I can't help but think it's going to bite us badly. Yeah, Kim is like Mussolini. So's DeSantis. He's got that kind of smarmy ass, fat face, bastard look to him too. Michelle, no, I get the cats sometime after July 9th. No research on monkeypox in infants, Christina. It literally hasn't been studied at all in that on that category. So, but sorry. If he becomes president, we're in trouble, David. So, y'all, please, whatever you do, we can't let DeSantis become president, for God's sakes. Yeah, I would love to have the kitties before my birthday. Because all I got to say is, that's just the cutest little face. that's Audrey. So, yeah, I can't. By the way, Audrey likes to climb up on shoulders. So, probably during lives, you're going to be seeing a kitten up here sometimes. So, thank you for the confetti, Leah. Yes, I had to send some homage to Audrey Hepburn there. So, beautiful brunette. No, it wasn't hard to choose just one kitten. Audrey I fell in love with her from at first sight just because she was so damn cute, and I'm adopting her mother also. So Lilith is coming home with me too. So yeah. And Audrey is definitely a mama's girl, and they're inseparable. She follows her everywhere. So they're gonna be sticking together. And yeah, Mama Julie, Lilith I actually named because when Friendly Ferals rescued the kittens, she only had like 200 followers, and I boosted her account so she could do lives to help get the kittens adopted. So, and it worked really well. She got like 1,500 followers from that boost video. So she let me name the mom. So I named the mom Lilith because at the time the kittens' names were Earth, Wind, and Fire, and I like that kind of elemental primeval theme. And with Lilith being the first, the true first woman, I kind of wanted to. I thought that would be a good name for their mother. So, but I also always said that whenever I get a kitten, the kitten's name's going to be Audrey. And so when I decided to adopt Earth, I hadn't thought about getting a second one, but my girlfriend kind of talked me into it because she planted that seed in my head, and it just grew. So, yeah, I love cats and I love kittens. Kittens are like the cutest things on earth. So they're just I don't know. They're just happy and playful and adorable. Yes, I have seen the monkeypox increase internationally. So I believe it was 3,083 cases most recently, and there were 2,2780 yesterday. Belly breathing, I have my clinic right here, which I get all the mail for. So if you were attempting to send something, if you send it there, I will get it. So, Shauna, I don't have them yet. They're still in Florida because Audrey needs to get to 4 pounds before she can get spayed, which is a condition of adoption. So, if I had all power to control monkeypox, what would I do? I'd make it go away. What would you think I'd do with it? That's just a weird question. Monkey to go? No, they're not. Okay. And get out of my room. And I don't allow that pseudoscience bullshit in here. So, but yeah, Shauna, yes, it will be a happy day. I'm hoping that I'll get them before my birthday, so which is July 18th. So, that would make me very happy. So, I mean, 97. You think I would ever move to a different state? Yeah, there's a possibility. Like if Louisiana started acting like Texas did, yes, I would. Like if they enacted that manifesto, yes, I would move to another state. So, besides monkeypox and COVID, anything else on the horizon? I'm concerned about measles personally. I think that we've dropped way too far below the herd immunity threshold, and that we are getting, and we dropped another couple of percent over the pandemic. I think that we are reaching the point in which we would that it's inevitable that we're going to get a major measles outbreak starting right now, or starting anytime soon. So I'm worried. I'm legit very worried about that scenario. Remember, measles is the most infectious disease known to man, okay? R naught is between 12 and 18 on that one. Worst case scenario for stealth plus COVID, it's R naught still 12 or 13. So, it might have parity with the low end of measles, but measles' high end goes much higher, and it is a wickedly communicable disease. So, well, May Shield, if you're back on here, you're not blocked. But I mean, yeah, if there was a misunderstanding, that's fine. You're not blocked now for sure. Okay. So, beautiful brunette, measles is true aerosol airborne. Okay. True aerosol airborne. It's like COVID. D King, you can have immunity can wane to measles, although generally, if you've had the proper vaccinations, or if you've had measles, you generally don't tend to get it again. Although, you don't. Mini Shield, what account got banned? You don't tend to get it more than once, so yeah, Gargana, you are bulletproof, girl. Um, 72 animal. Measles and mumps are other childhood diseases that are two of, I believe it's 21 diseases that kids are now vaccinated for. Those have been vaccinated for quite some time. Measles was particularly easy to spread and killed about 1 in 1,000 to 1 in 500 people that got it, except it was all kids that would die, and other kids would be rendered permanently deaf from measles encephalitis. So, I don't know if there's still supply chain issues for the shingles vaccine, Susan. Do I believe monkeypox will become a pandemic? No. Do I believe monkeypox is going to go away, though? No. I believe it's going to be a smoldering, continuous outbreak. I just don't think it's going to reach numbers. It's going to have pandemic status. So, you cannot aerosolize hepatitis, Sleeping Beauty. That's impossible. That is not something that we have currently ever had reported. So, now, yeah, Leah, if you got measles is infectious enough, if you're in an elevator with someone with measles, yeah, you could get it. So, yeah, Mini Shield, there's a vaccine for measles. Yeah, it's a highly effective vaccine too. Kelsey Blaine, I'm sorry, I hope you feel better quickly. Look, yeah, remember though, the thing is people think that, this is what kills me about the people with the COVID vaccine, is they were upset that breakthrough infections occurred. Okay, remember, breakthrough infections occur with almost all vaccines. So, there are very few vaccines which are 100%. There are almost very, very few. So, but Galen, you're welcome to DM me, but if it's something that that's and I'd be interested to hear it, but it's also not something. If it's something that involves buying or selling something, I don't have any capability to do that right now. So, Garden of Eden, how are you doing? So, but I'm starting to run out of gas, y'all, so I'm probably going to sign off here. It's also past 9 o'clock, which means that I do have to get my beauty sleep, so to preserve a little beauty. Mini Shields, the best way is to get vaccinated for it. If you are concerned that the vaccine might not have taken, there is a titer for it. You can get that tested, okay? As well, that generally covers you for life, but if it doesn't, you might need a booster shot for it. So, thank you, Leah, for the lights, the lamps. So, but yeah, I'm like that. I take my melatonin gummy, and then I usually around 8:45, and right about 20 minutes later, I start to I kind of wind down around this time normally, anyways. So. But anyways, I had a lot of fun doing this, and well, great. I'm back doing the live, so every Tuesday and Thursday, besides possibly this coming Thursday, and a lot of Sundays I do lives also. So I mean, I do a lot of them now. So anyways. Y'all, thank you for listening to me, and thanks for showing up and everything and supporting me and for being generally awesome, okay? I love y'all. And this Thursday, I may not be on because I may be visiting my girlfriend. I don't know yet. But stay safe, okay? Bye.